Alright, welcome back everyone. Today we're going to go over section 15.4 pretty quickly. I'm not going to go into too much detail here, but this is talking about drugs that will affect the autonomic system. And so we'll talk about drugs that elicit a sympathetic effect, and then we'll talk about drugs that elicit a parasympathetic effect. But let's first get into the sympathetic effect. And so the neurochemistry of your sympathetic system is based on the adrenergic system. And there's two chemicals, norepinephrine and epinephrine. Epinephrine is actually adrenaline, and norepinephrine is noradrenaline, but we'll keep talking about them as norepinephrine and epinephrine. And they influence these target effectors by binding to either alpha adrenergic or beta adrenergic receptors. And basically, all you need to know is there's going to be two types of drugs that are classified by what they do. Either they enhance the functions of the sympathetic system or they interrupt the functions of the sympathetic system. So a drug that enhances it is known as a sympathomimetic drug, and a drug that interrupts it is called a sympatholytic drug. So let's talk about sympathomimetic drugs. They help when the sympathetic system isn't working correctly by either mimicking a chemical, norepinephrine, or stimulating the release of more norepinephrine. Another thing they might do is also to block the reuptake of the neurotransmitter that tells the body to produce norepinephrine. So if you block the reuptake of that, the body will continue to produce it, and that just increases the effectiveness of the drug overall. One common sympathomimetic drug is phenylephrine, and it's a common component in decongestants, and it's what is mostly used today in things like Tylenol or Excedrin, and it does great things by if you have sinus congestion, it can basically stimulate them so that you can get this mucus out. But I think the more important one to talk about, and sort of the more interesting one, is pseudoephedrine, which was included in a drug called Sudafed, and other various drugs, but Sudafed's the one I think of. And it used to be really common because it's a really good decongestant, and you used to be able to get just as much of it as you want, but we found out that it's actually really good in the illicit production of amphetamines, or basically the production of meth. And what's interesting is phenylephrine, which is the one that you can get more readily now, is not as effective because it can actually be partially broken down in your digestive tract before it's ever absorbed and ever being able to used. So some of the things it can also do is to dilate the pupil during an eye exam, or it can increase your blood pressure, or once again, it can also be used as a decongestant. Some other things that I'd like to talk about are cocaine, which can alter the function of your sympathetic system. And we talked a little bit about it before in a previous video that I posted. But what it does is prevents the uptake of dopamine, which is a chemical that basically makes you feel good. And if you prevent the uptake of dopamine, you basically feel good for a extended period of time. And that sounds great, but actually it has really harmful effects in the long run. One of the things that it does is it will actually decrease your body's sensitivity to dopamine. And what that means is that you're going to have to use a lot more dopamine to ever feel good again, which basically means you're going to have to continue to use cocaine if you want to feel good again. And so, like that video said, don't do cocaine. And then the other one I'd like to talk about that we're all pretty familiar with is caffeine. And caffeine is an antagonist to a chemical called adenosine. And adenosine suppresses adrenergic activity. And so basically, if you can suppress adenosine, you will increase the effect of the adrenergic system, which would basically increase the effect of these types of drugs. And so what you'll see is that caffeine will be included in these drugs to increase their effectiveness. Okay, and so let's talk about the sympatholytic drugs next. When we talk about the sympatholytic drugs, they are drugs that are going to interfere with sympathetic function. So there are antagonists to the adrenergic receptors, and what that means is that they block the ability of norepinephrine or epinephrine to bind to their receptors. And there are specific drugs that are going to either target the alpha receptors or beta receptors, and those are called alpha and beta blockers. The most familiar of these are the beta blockers, and these drugs are often used to treat cardiovascular disease because they block beta receptors, which are associated with vasoconstriction and cardioacceleration. And so basically that allows the blood vessels to dilate and basically keeps the heart rate from increasing. Another use for a sympatholytic drug is an anti-anxiety medication. And one type that we'll talk about is an alpha agonist, and basically that's an alpha blocker, and we call that clonidine. And clonidine will help to calm down your flight, or fright response and basically stop the anxiety. All right, lastly, I'd like to cover drugs that have a parasympathetic effect. And these drugs either increase or decrease activity at the postganglionic terminals. And these fibers will release acetylcholine, and the receptors are the targets on the muscarinic receptors. And so there's two types that either enhance cholinergic effects or inhibit them. If they enhance them, they are called parasympathomimetic drugs, and if they inhibit them, they are called anticholinergic drugs. One example is pilocarpine, which is a non-specific muscarinic and agonist, and basically it is used to treat disorders of the eye. And it reverses what we previously talked about, that mydriasis, which is caused by phenylephrine, which dilates your eye, and this can reverse it, so it'll be administered after an eye exam. And then one other one I'd like to talk about is atropine and scopolamine, which are part of this muscarinic antagonist, and they come from this type of plant genus Atropa. And basically there's two types. Belladonna was what it used to be called, but also be called deadly nightshade. And basically what belladonna did was it would dilate your pupil, and people found this to be relatively attractive because it makes your eyes larger. And humans are actually instinctively attracted to anything with larger eyes because babies actually have large eyes. And so it stimulates an emotional response. And that was great and everything, but we decided not to use that because it's actually nightshade, which basically can suppress your parasympathetic function so much that it can become deadly. If you accidentally take any of this, the antidote for it is pilocarpine. And so that's all I want to get into with these drugs. You can read a little bit more about drug types here, but that's all I'm going to cover here, and look forward to seeing you in the next one.